So I've been the police chief here in Gates since 2013, which is just over 6 years. I've been a police officer since 1985, which is about 35 years. There have been some significant changes over the lifetime of my career of 35 years, and I think that's why I've become so much outspoken and involved in it. I was here on the road during the cocaine epidemic back in the late 80s, early 90s. A lot of people are using cocaine. However, that was a much different drug. We didn't have the abusers dying the way they are now, and most everybody was able to overcome their addiction from cocaine. It seems to be a lot easier to get over the cocaine than the opiate situation. Opiates, what I'm finding, is very, very difficult to overcome. And again, I think when you talk to Jim Wesley, that'll be a good question for him. What makes the opiates so much more stronger to get over? And he can probably give you the more of the scientific reason. But no, the opiate thing is really an uphill battle. I would say that recovery is possible. However, it is an uphill battle, and many people relapse, and we can get into the reasons why as we get into the interview. But the problem is the consequences, because of the fentanyl that got introduced to the drug stream about 5 years ago, has upped the ante on what happens to people that use the opiates because of fentanyl, which is then killing them all. So this is much more serious than the cocaine epidemic was, and that was bad as it was, sad and bad. But this is just deadly, outright deadly. What's happening?
Right.
The real numbers, we do have a guesstimate based on what law enforcement has been trying to. If we go to a death scene, we take that number and we call it into a central location. We did that on our own because we couldn't wait for the medical examiner's office. Their numbers come out too slow. So we've been tracking them month by month. Our guesstimate is around 166 deaths for 2018. But I'm sure there's a lot that fall through the cracks. So we would expect that it's got to be higher because we know, things fall through the cracks. Not every call gets called in, or some deaths end up being ruled an overdose that we didn't know it was. So again, our estimate is 166. We're waiting any day for that report to come out, just to see where the numbers do shake out for 2018.
Okay.
And then your overall overdoses are usually around 1,000 to 1,200.
Okay.
And those are just the ones that are reported to law enforcement.
Right.
There's probably a lot more that you don't hear about, or people take care of with their Narcan kit and don't call. So what we've seen since January 2019, surprisingly, everything has significantly come down. For example, before January, we were averaging anywhere between 15 deaths and 25 deaths a month. Mm-hmm. And we would average between 80 and 120 total overdoses. The numbers have greatly come down since January. For example, if you look at the numbers for April, there were like 36 overdoses and only 4 deaths, and that's like unheard of to be that low. Mm-hmm. So the question becomes, what's causing it? And again, my speculative answer to that is, because the overall overdoses, that's really what you want to look at, is how many people overdose. Because whether somebody lived or died is a roll of the dice. Mm-hmm. What I'm looking at is that overall number. And to be down so low tells me, I think there's been a change in the drug supply. I think less fentanyl is being used. And there could be a variety of reasons why that's happening, right? I mean, A, if you're a drug dealer, you don't want to kill all your customers because those are your customers. 2, there's so much publicity out there and attention has been given to the heroin epidemic because of all the deaths. So if you want to take the law enforcement's attention away from it and go back to not killing your customers and toning down the fentanyl, it'll kind of help your business, I think. So that's personally my speculative answer. Again, because I'm looking at the overall number of overdoses, right? If we said it was because of the Narcan alone, we would still have a high number of overdoses and we would just have a lower number of deaths. But since the overall number of overdoses is significantly coming down, I think there's been a change in the drug supply and how much fentanyl is being used to give you that bigger boost for your buck.
Do you think a lot of the fentanyl is coming from China?
That's what I get from the federal agencies, mm-hmm. the drug enforcement agencies. As China is where the fentanyl comes from.
Okay.
So what has caused this thing? Well, I don't know specifically, but I do know America has a mental health issue, and America has a drug habit. But the two are interwoven. You have to address the two of them, right? If you look at most of the problems that's going on in our country, right? The mass shootings, the teen suicide, the suicide rate that's going up, the drug use. If you look at the underlying problems of a lot of that, it's the mental health issue. Mm-hmm. And so, as public officials, we should be focusing on our public policies, I believe, in law enforcement's opinion, mental health services and addiction services, and prevention of both of those. You should be spending double, triple the amount of money that we spend now on those services and address those issues, because if you look at most of the calls for service that the police go on, there's an addiction problem present or a mental health issue present is what drives most of those calls to 911. Right. And so, and unfortunately, what we don't have is access to treatment.
Right.
And when I say treatment, I'm talking like real treatment. Okay. Right. I know some people right off the top of my head in the past month that went away to a 2-week inpatient program, only to come out days later and just be back out on the street. 2 weeks is not going to cure anything. Right. When I'm talking about treatment, I'm talking about 6 months or more is what an inpatient controlled lifestyle. If you have someone that's been using drugs for 5 years, okay, and that's a small, there's people who've been using drugs for decades. Mm-hmm. It's going to take a year or more to break that cycle mm-hmm. of using drugs. So even these 30-day programs. Now, how did we get to these programs, right? A lot of this is all controlled by your health insurance, right? The health insurance says, hey, we're going to pay 30 days. So guess what? The programs are 30 days, right? If they said we're going to pay 60 days, then the programs will be 60 days. So if we look at legislation or look at public policy, we need to be focusing on the healthcare system, right? On getting those extensions raised on what they're going to pay for treatment. Everything's based on pay. Who's going to get paid to provide the treatment? Right. Or do we create more government-run treatment facilities? Where the government gets into the business of doing it. But one way or another, if you want to stop all these mass shootings, you want to stop all this craziness that's going on every night on 6 o'clock news, we've got to address we got to get serious about the mental health issue and the addiction problem. Yeah. And as well as, this is all stuff we should be talking about in elementary school, and it should follow you through your years of high school. This issue of addiction, taking care of yourself physically, mentally, it's all related. And our DARE programs were great, but having DARE for 1 year in elementary school, that doesn't, it's got to carry through the 12 years of your schooling. Right. To get home the mess. If we're going to do this seriously, I mean, if we really want to do this is how you got to do it. And it's all about a healthy lifestyle. What's a healthy lifestyle so that you don't find you have to go get high every day. You can't get through a 24-hour day without getting some sort of a high, you know what I mean? Right. How do we stop that? How do we change that?
Yeah, that's one of the things that kind of
it's all about your environment and a healthy lifestyle. If you take a kid or take anybody, take them out of a bad environment, right? If I'm going to live in an area where there's drugs being sold all the time and the access to the open air drug market is right there, what do you think I'm going to do? Right? Change that environment. Put somebody somewhere in a healthy neighborhood, a healthy area where you don't have the open air drugs, and they have a support base. They're going to live a righteous lifestyle. It's all about, everything's connected, from the mental health, the support base that you have within your life. It doesn't always just have to be family. You got best friends and things like that, and the environment in which you live in is going to play an impact on who you are as a person. What was the question?
Yeah, could you tell me about some of the
flaws or the
flaws in the drug treatment now, in terms of?
So the flaws that we face right now, and again, this is just from my position as the police department, right? Because we respond on all the 911. This is what we're seeing. I have no PhD, I have no textbook study. This is what we're seeing in real life in the trenches. As it all comes back to this lack of insurance coverage, lack of easy access. Oftentimes, we have one detox center here in Rochester over on University Avenue called Helio Health. Now, I think they now have 40 beds over there. But even then, there's days, and it's get there at 8 a.m. and it's first come, first serve. So if 3 people are released, 3 people get brought into the program. And if there's 5 of you, then 2 of you go home, and by the grace of God, you come back tomorrow if you're not out back on the streets. So again, this whole idea of lack of access, and again, Jim Wesley knows a lot of the stuff that you were just talking about. Go back for a minute about the the cell phone usage. And, but he also, because he worked in the hospital setting, he understands how the medical world operates based on the financial things,
Right.
And I'll give you an example of somebody who walks in with heart disease. That's a guaranteed $200,000 diagnosis.
Right.
I mean, somebody walks in with a drug addiction, $30,000. And unfortunately, it's all based on. If I got 100 beds in my hospital, which ones do you want to have? The heart people that are going to be a $200,000 bill, or do you want our drug addiction beds that are only going to generate?
Right.
So a lot of this healthcare stuff is all based on money. So you can imagine why the beds are harder to get locally in our hospitals and outpatient stuff. It's all about money. It's all driven by money and the insurance industry. So the question becomes, what is government's role? Then how do we, right? If the private sector isn't getting the job done, and we have all these people dying, then at some point government's got to step in and say, this is what we're going to do, since the private sector isn't sustaining what we need.
Right. We just talked to our friend Travis, and he's in recovery for 2 years, and he said that was the one big problem too, is their lack of bed.
Well, I just wrote a letter yesterday. I can give you a copy of it, to the commissioner of the New York State Department of Health. Sitting here as a frustrated police chief, I sat down and typed him a letter saying, one of the obstacles we're facing right here in our local community is when the police bring somebody to the hospital, they overdosed, or we mental hygiene them because they've used so much heroin they're not, they're a threat to themselves or something. That there's no standardized protocols in place of how that person should be treated. Okay, so it's hit or miss whatever happens to that patient that goes in. If it's after, and I'm just making this up, but if it's after 5 o'clock, perhaps all your addiction specialists are gone home. The person comes in, they treat them. Emergency rooms are very good at treating acute symptoms, right? You go in with a broken arm, they set your arm, and then they say, hey, call this bone guy for the follow-up, right? You got a heart, you got chest pains, they treat you right then and there for the chest pains, and then they're going to follow up with a cardiologist. And so they're very good at that, right? So typically what we've seen as the police, when we bring somebody in, they're very good at getting them all stabilized, right? They get them all hydrated, get them back to normal. And then that pretty much ends the hospital's involvement, and they send them back out. And we've had many, many cases where someone has overdosed, 6 hours later, 8 hours later, 2 days later, they're now dead in my town. And I think, geez, we just brought them to one of the best hospitals in the country, right, the U of R, 2 days ago, and how is it now that they're home and they're dead, right? Was there any follow-up? Was there any... And so what I'm finding is there is no follow. A lot of these hospitals, nobody follows up, right? We have all these, case workers. We have social workers. Is anyone calling that person the next day and following up with them and saying, hey, how you feeling? What are you doing? How about trying this treatment program? So I wrote a letter asking him if, his authority as the New York State Commissioner of Public Health, would you have the authority to implement standardized protocols? So whether I walked into a hospital in Dansville or a hospital in Rochester, they're going to treat the person for the acute issues, and then they're going to, hey, here's part 2, right? For example, right? And this is just one common sense thing, right? If you come in with an addiction problem, I just treat you. I mean, everybody should be going home with an Narcan kit, right? Mm-hmm. I mean, at the very least, why wouldn't I send you home with an Narcan kit? Right. Let alone, right, there should be some sort of a drug assessment done for you. And I realize you can't force treatment. Someone's got to be ready. But at least they're walking out of there with some resources in their pocket if they are serious about treatment, because right now none of that's happening. They treat them, they get them all stable, and they say, sign here and you're out the door. So the pieces of the puzzle are not being connected, right? And the state of New York, through the OASIS, it's called, the Office of Alcoholism, Chemical, Substance Abuse, they spend millions on all these programs, for rehabilitation and all this stuff. So New York's paying for all these programs, but we don't connect them, right? And oftentimes that's where it starts, is in the emergency room, right? That's when they finally hit their bottom, right? If you're in the emergency room, man, then something bad has happened to you, right? You've overdosed, you've just had a really bad experience, and oftentimes that's when you want to hit somebody, right? That's when you want to approach somebody and say, hey, you ready yet? Are we done? Yeah. Are we sick of waking up like this? But none of that seems to be happening. So I wrote a letter yesterday saying, hey, maybe we should consider implementing protocols. For example, right, we just went through this flu season, right? We saw it on the news every day. Oh, we're up to 14 people have died all winter from the flu. Yeah. And then every time I walked into an emergency room this winter, right, I see everybody had masks on, and you're only allowed 2 visitors because of the flu. See, these looked like standardized protocols, right? Who did that, right? Somebody said, hey, we have a flu epidemic going on right now. If you come in and you're saying you've got the flu, we're going to immediately mask you. We're going to quarantine you. You see how standardized protocols so that we don't spread the flu. Yeah. So that's my whole question as the police chief. We need standardized protocols in place for these people that come in with an overdose, because if you're just sending them out on the street, you just gave them a death sentence, right? I mean, if you just give them a ham sandwich and give them a free bus pass to get back to where they came from, I mean, you're just giving them a death sentence. That's not going to solve anything. So we just keep chasing our tail around, and then they overdose again and come back in. So, a lot of this is it seems common sense, but a lot of times these services just are not being hooked up where they should be, Mm-hmm. I became really passionate when I started meeting the families, as I started going on the calls myself as the chief, to go by these calls. When we started seeing an uptick, I became really interested. First of all, I was shocked. I was like, I can't believe I have this many people in my town using heroin, right? Because back in the day, heroin was that Hollywood scene that we've all seen in a movie, right? I mean, very few people were using heroin. You were really strung out. If you were shooting heroin, and I mean, that was like, we all had a perception of those were the ones that were really into drugs, Mm-hmm. And then all of a sudden we started getting all these deaths in my town, and there was no notice, there was no memo that came to me from the federal government or the local government. Hey, just so you know, we're in the middle of a heroin epidemic. I don't know if anyone even saw this thing coming, right? Other than I started seeing all the deaths come in, and then one day a news reporter called me and asked me, hey, have you guys seen an uptick in overdose deaths? And I said, it's funny you said that, because we have. And then I started looking into it more. And again, I didn't know anything about this stuff, and then I started looking into, well, how can I have so many residents in my town using heroin, And then as I began to educate myself and read about it, I said, a lot of I didn't realize the prescription pain meds were the same chemical ingredient that's in heroin, And then it all started to make sense. Once you figured out the pharmaceutical spin on all this, where people became addicted from their Oxycontin and their regular pain meds, and then when they couldn't get their hands on that and they were still addicted to it, then you went out and you got the heroin, because the heroin has the same chemical makeup, and then the heroin got spiked with the fentanyl, which then caused all the deaths to start. So yeah, it was a big learning curve to understand all this stuff.
And then
we started to change our philosophy as a police department, right? We're not going to just go to your house, put you on an ambulance gurney and send you to the hospital, or we're not going to just go to the local store where you got arrested for shoplifting, bring you in here and just process you, knowing that you committed that larceny because you have a drug habit. I then said, we have got to do more as a police department. We have got to start directing people to recovery and what recovery looks like. I'd rather solve your problem so I don't have to see you again. Believe it or not, the police are not just in the business of wanting to arrest people. We'd rather just solve the problem, whatever that problem is that led you to commit that crime today. And so we said, and then we realized how deadly this heroin problem was. we then started getting into the business of referring people to treatment. And if I was going to refer people to treatment, I needed to educate myself on, what is a 30-day inpatient program? What's an inpatient program? What's a halfway house? What's a outpatient program like that? Who might succeed in an outpatient program versus an inpatient program? So I literally took field trips, and on every field trip I'd come back and I'd post it on our Facebook page, and I called it a field trip. The chief went on a field trip today, and I would introduce where I went, what facility I toured: Catholic Family Center, Open Door Mission, Salvation Army, Clifton Springs, Erie County Medical Center up there. We've been down to Pennsylvania, and I had to understand this myself before I could refer somebody to this stuff. I needed to figure out what this was and how this all operates, and which ones were somewhere that I would want to send one of my own loved ones.
How?
Well, again, it's gonna require government intervention because it all involves. It's all about the dollars and cents, right? Your medical industry is a private industry, right? It's a private company. It's based on dollars and cents and profit. Your 2 or 3 major healthcare providers, Rochester Regional Health, U of R, they're driven by profit, right? Mm-hmm. And so, if you want to get more beds, there's got to be more government intervention, either some sort of legislation that mandates a certain amount of beds, or the government's going to have to come in and subsidize or do something to get the private. You want the private sector to pick this all up and run with the ball, but it's all going to be based on dollars and cents. So if we're going to be talking about this, there's got to be some sort of intervention with the government. Your next one is the state. I just watched the budget when they released the budget in March. I think it went from $200 million to maybe $250 million in the state budget to address the opioid problem. Now, in our state budget, $250 million isn't,
Yeah.
it's money, but it's not a lot of money.
Yeah.
It still isn't a priority, right? If we're serious about wanting to save lives, reduce all this chaos that goes on in our communities every day, we've got to address the mental health issues. And it's all about when the police come and pick you up, I've got to have a place to bring you right then and there. I can't wait a day or two. There's got to be a vehicle in place where I can bring somebody, whether it's a mental health issue or a substance abuse issue. You got to strike while the iron's hot.
Right.
Question: what would I tell somebody who has a drug problem? Your life will be so much more significantly better if you're sober. And I have so many friends and acquaintances that I've met in the past 3 years because of this epidemic who are in recovery. And many of them I knew when they were actively using drugs because I used to arrest them all the time. We call it cops and robbers today when we go out and we talk. It was, I used to chase this guy all the time and arrest him all the time. And today we're best friends because we're all working together now to get the word out about it. And now that I see him and he's sober, nicest guy in the world. So
What's his name?
Randy Semino. I can get. Yeah, he was on the panel with me.
Oh, okay.
Randy. Yeah. I can get him. So my message is: if you've got to get yourself into some treatment. A sober life you will enjoy a sober life so much more than the carnage and chaos that comes with a life of addiction.
How do you view other people? It's kind of similar. How do you view?
So I would guesstimate that probably 80% of all the calls that we go on, there's an addiction problem behind it. And I'm going to say addiction, I'm talking about alcohol, marijuana, any of the substances that numbs your brain.
Yeah.
An addiction problem is behind most 80% of all the calls. Whether we're going for a routine shoplifter, when you start to talk to the person, you find out why they're shoplifting. It's to support that habit. When we go on domestics, fights, somebody's high, somebody's drunk, somebody's, when you're not in your right frame of mind, we take risks that we normally wouldn't do. We do things that we normally wouldn't do. We fight. We injure ourselves because we did something stupid. Many of the suicide scenes I go to, one of the things that are present when you see somebody who's hung themselves or shot themselves, present at the scene is usually some sort of evidence of a substance abuse problem. They drank before they got the courage to shoot themselves, or they used some kind of drugs and then they gave them the courage to do it, or The average citizen has no clue. This addiction problem, if we had no drugs in our world, right, you could probably eliminate half the police, and it'd be a great community we have. But because that's how bad the addiction problem is, and how much of that addiction problem fuels other events, right? Walk-ins to the emergency room, right? Somebody's got a cut to their arm. Well, how'd you get the cut? Well, they were drunk and they put their hand through the window. How many calls in the emergency room are driven because somebody was not in their right frame of mind and they did something risky? They did something that they normally wouldn't do. Addiction is often behind most of the calls that we go on.
Okay. What do you think about the needle exchange?
I can say one thing, and again, I work closely with Trillium Health there, who does all the harm reduction training, and clearly the needle exchange program really helped in the AIDS epidemic when that was going on. Having access to clean needles reduced a lot of the diseases and illnesses that go with needle sharing. So it clearly has worked and has been a great tool in the spread of AIDS and stuff like that. Now, we do have the other issue of we now have hypodermic needles all over the place, which then leads you to a question: do you put some sort of a deposit on needles? Somebody was asking me that question the other day. Hey, how about a 5-cent deposit on a needle? If you bring in the whole needle, it's worth 5 cents or something like that, to prevent people from just throwing them on the ground like that. Right. That's our next question. Not how do we clean up all the needles, right? It's not a safe environment to have needles all over the place. But we have corrected the other problem of HIV and stuff like that because of that needle exchange program.
Right. Have you heard of Hope Dealers? Oh, okay. Nice.
I'm going to see them tonight. We're all going out in a parade tonight.
Oh, are you?
Yeah, it might be worth. I don't know what your story is, but so tonight the van goes out to Spencerport, right over here in the next town over. They got a 7:00 parade. I got probably about 40 family members that are all going to be carrying the sign of their loved one who's passed away. And the van's out back here. If you want to shoot some footage of the van,
okay,
it's sitting right out in the back there. It's 75 photos of people have all passed away, and if you look at that van, it looks just like your neighbor, your classmates. This isn't the boogeyman. You look at that van, and you say, "Whoa."
Yeah.
And so tonight, what we're doing as part of this public awareness campaign is we're taking our van, and it all came out of Gates. This is one of my brainstorms. It's, hey, we gotta put a face to this thing.
Mm-hmm.
And I went to these guys in Soares. Hey, get me the families. I got the van. I got the guy who will do the graphics. I don't know the families. You guys know the families, and so so we're all working together. But we've been in the Lilac Parade, and our goal is to get in as many parades as we can. Put the van out there and have people walking. Again, just to get the message out there. And trust me, I know specifically because I know the chief over in Spencerport real well. He's had at least 3 or 4 deaths right in that little village, So this will hit home tonight when that van's in the parade because there'll be people sitting there and know exactly what we're talking about. So it's been a good tool. And again, that's an educational tool. When we get back to how do you educate people.
Yeah, we're going to interview them on Sunday.
Yeah, at the radio show, or how are they going to do it? Are you going to meet? Oh, you're going to meet them out on the street when they're picking up their needles? Yeah.
Some footage of that.
I'm a government, obviously. I'm part of the government. Who's kicked butt, and who's kicked butt in this epidemic has been the government, right? It's been these grassroots organizations that have really kicked some butt out there. Yeah. The Soares, the Hope Dealers, the Gates of Recovery.
What was the first one?
Soares, SOARS, and you'll have to look it up. Becky Baker is the Becky Baker. That group is all the families who have lost a loved one, right? They have their own group. She's got about 1,500 members. Hope Dealers, again, it's about going out on the street, the grassroots level, picking up the needles, meeting the people. And then you got Gates to Recovery that we started here. But it's been the grassroots people that gotten things done because government has too many issues and regulations. Well, you shouldn't be out picking up needles. We'd have to have gloves on and a mask on, and But then you could go to the grassroots people, just get it done, right?
Yeah, right.
Go out and pick the needles up, and let's make a difference, right? Because if we sit here and we wait, Oh my God! So really, the heroes of this whole thing, this whole epidemic, the heroes have been the grassroots, those nonprofit organizations that are out there. Don't have to follow government regulations, just get stuff done.
Do you have Becky Baker's number that maybe we can reach out to her?
Absolutely. And all like vital to me is that they all give me as a police department somewhere to send people, right? Mm-hmm. So, I've already had like 4 deaths this year in my town. So besides going there and we deal with that, I also have an opportunity now to deal with this new family that just lost their loved one and introduce them to people like Becky Baker who have weekly and monthly support groups and for one mother, to talk to another mother, it's so important to be able to have somebody that understands what just happened. You know what I mean? Right. So this gives me an opportunity to a place to send people. And so that's why I've also become very close to them. Because I need them, they need me. I got the customers, they need the customers, and I need them, so I can send people to. You see how this is all it's all like this,
Yeah, it's almost like rebuilding a community.
Yeah, right. So 2 years ago, we had a public forum at our town library, a public forum on the opiate epidemic, and as part of the panel was like me, the police chief, the town supervisor. We had a couple. People that are dealing with it every day like that, and this guy Dave Attridge, who was in recovery, right, and Dave was real big in the recovery stuff and wanting to get out there. So about 100 people showed up to the forum, and they live streamed it. Another 200 live streamed it, and it was a big turnout and a lot of excitement. And so afterwards, we was hanging out with this Dave Attridge, and he's like, if you can give me a location, a room, a building to use, I can do like a drop-in center, since I've been through the system. Now, he has no PhD, he has no degrees, but he's got a degree in life, Having been an addict for many years, he has a lot of valuable experience and the ability to talk to people and give them an opinion on what he thinks, your loved one might need or something like that. And so he said, look, you give me the space, I'll provide the services. Right? And that'll also give you as a police department an opportunity to hand out people, give them my phone number, see how we needed each other to be successful, right? And at the time, there was nothing going on here in Monroe County, which was frustrating me as the police chief. I was going to the countywide government, and say, hey, we need a hotline or something, right? So when I go on a call, I can tell somebody, call this one. We should have one phone number for all of Monroe County, and they've done this up in other communities like Erie County. The Erie County government took on that responsibility of providing a hotline. We had nothing in Monroe County, so we were the first to start this partnership. We called it, and we just came up with the name Gates to Recovery. We'll open every Thursday in our town hall here. We'll provide a room. Come on in if you want to talk. If you need resources on where to go, what to do. You need health insurance. One-stop shop, and come. And really, more importantly, what brings people is the hotline that we have.
Yeah.
We get more people will call the hotline than actually physically will walk in here. This is that hotline. And so we've been very successful. I don't know. We probably average 40 calls a month that come in on the hotline, as well as the people that walk in. And a lot of times, typically what happens, right, is, you have an addiction problem, your mom and dad are going to come first, right. I mean, the addict doesn't just walk in here. It's usually a loved one who comes in and says, this is what I got going, how do I do it, where do we start, you know what I mean? Mm-hmm. And then eventually we end up meeting them, the person with the addiction problem, and again, we're just here to lay out the options. It's very complicated, right? If this problem just popped up in your family tomorrow, you'd be like, where do I start, right? You'd probably sit there and Google drug treatment centers. You'd be like, where else do you start, right? I mean, and a lot of your PCP, primary care physicians, they don't know much about this either. So that's what the purpose of this was hey, come on in and see us, and we'll work with you, and we'll see what's going on and kind of give you some suggestions on what to do. And now we have 4 different locations besides the town, the Gates. We have Brockport, we have Webster, Henrietta. And then one that covers East Rochester and Fairport. Nothing more than a grassroots effort. And what was interesting, right? Now, what gives us legitimacy is the police department's behind it. You know what I mean? We're supporting it, and we're giving the building. When this first broke, right, all this negative, some real negative comments came out about the healthcare world in Rochester, because the news covered this big time, right? Oh my gosh, common sense, right? We're going to have a drop-in center with a phone number. And then a lot of the big healthcare providers, well, they're nice people at what they're trying to do, but they can't do that. They're not certified. They don't know this. They don't know that. Yeah, okay, but then where are you guys? Okay,
Right.
If you think people are going to walk into your hospital, you need to get out on the streets. That's what pisses me off about these people, right? Yeah, they're all these experts, and they all have these PhDs and shit. You ain't nothing if you're not out on Clinton Avenue. You're not out here in the town of Gates. You're not out walking in my community and going to these houses. Go follow up 2 days later. When I go to an overdose call, you should be going over there 2 days later and saying, hey, you guys all set? What do you need? No, they don't want to do that because it costs money. It costs staff, right? It costs resources to outreach. Right. So they don't, and then they make fun of us, right, that we're doing this. Well, you guys don't have PhDs. You're not certified to do any of that stuff. Right. Well, we're not giving them advice. We're just giving them some guidance on where to go and try this, call this number, try these, here's 3 different treatment centers. Give them a call and feel them out, you know what I mean? We're not here to give advice. We're not here to say we're counselors or any of that other stuff. We're just here to understand, what's Willard. I didn't know what Willard was, or Clifton Springs, where do you go for these places? So that's all this was an ability for people to come to us, and because we do it in the communities, right?
Yeah.
Or in the communities instead of sitting in some medical office complex.
In a White House.
Right, we look at, if you got skin in the game and you really understand what we're talking about on this show, then it's our job to hold public officials accountable, right? We got to hold their feet to the fire. And you need to know when these elections come up, like this year, okay, we have some very significant local elections coming up. You need to know where these people stand and what have they done. If they're up for re-election, you should be asking them, what have you done? And where do these people stand on this? Because I got to be honest with you, there's still a stigma out there. There's a lot of people, a lot of public officials, a lot of leaders that don't want to be bothered with this, and kind of have that thought that I used to have, So, yeah, if you want to make a change, then you need to take the election seriously. You need to figure out what public officials are supporting drug treatment thing. And you've learned now from this interview what we need, right? We need access to drug treatment facilities. We need more education, right? It needs to be in the school from day one, not just DARE program in the 4th grade, right? It has to be the prevention has to start. We need the mental health services. The mental health goes hand in hand with the drug addiction. So, as a citizen, when people say, "What can I do?" Well, you need to figure out who your leaders are and what they're doing.
Okay. All right. I think that's it. I think we just need some B-roll and
Sure.